Policymakers, healthcare providers, and advocacy groups play a crucial role in addressing legislative barriers and ensuring funding for people living with HIV and people experiencing homelessness. By working together, these stakeholders can create comprehensive solutions to support individuals in need and improve overall public health outcomes. Let's explore 15 key outlines outlining the importance of collaboration among policymakers, healthcare providers, and advocacy groups in addressing the challenges faced by individuals living with HIV and experiencing homelessness. To begin with, policymakers must prioritize HIV and homelessness as key issues in their legislative agenda. By enacting policies that allocate resources and funding to support programs and services for these populations, policymakers demonstrate their commitment to addressing these pressing public health concerns. For example, legislation that mandates affordable housing options for individuals with HIV can significantly reduce homelessness rates and improve health outcomes for this vulnerable population. Healthcare providers also play a critical role in addressing the needs of individuals living with HIV and experiencing homelessness. By providing culturally competent care and services, healthcare providers can ensure that patients receive the support they need to manage their health conditions effectively. For example, healthcare providers can offer HIV testing and counseling services in homeless shelters to reach individuals who may not have access to traditional healthcare settings. Advocacy groups serve as a vital voice for individuals living with HIV and experiencing homelessness, advocating for policy changes and funding to support these populations. By raising awareness about the challenges faced by these individuals, advocacy groups can mobilize community support and pressure policymakers to take action. For example, advocacy groups can organize rallies and campaigns to raise awareness about the need for affordable housing options for individuals living with HIV. Collaboration among policymakers, healthcare providers, and advocacy groups is essential to address the complex challenges faced by individuals living with HIV and experiencing homelessness. By working together, these stakeholders can leverage their unique expertise and resources to develop comprehensive solutions that meet the needs of these vulnerable populations. For example, policymakers can work with healthcare providers to develop policies that prioritize HIV testing and treatment for individuals experiencing homelessness, while advocacy groups can advocate for increased funding for supportive housing programs. In conclusion, policymakers, healthcare providers, and advocacy groups must work in concert to address legislative barriers and ensure funding for people living with HIV and people experiencing homelessness. By prioritizing these populations in their policy agendas, providing culturally competent care and services, and advocating for their needs, these stakeholders can create positive change and improve health outcomes for individuals in need. Collaboration is key to success in addressing the challenges faced by individuals living with HIV and experiencing homelessness, and by working together, we can create a more inclusive and supportive healthcare system for all. 10 down WJENT